We're going to be talking about headaches. How many people have suffered with headaches before, right? By the way, what they say on TV is not always true. Okay, so don't always believe everything that you hear. For instance, when they say if you have a normal morning headache, okay, headaches any time of the day are not normal. Okay, so some of the Bayer commercials and other things like that, they'll say, come on in, Beth, when you have a normal morning headache, just take a Bayer or whatever. Okay, well, they are not normal, number one. Number two, let me ask you before I answer this, what do you think the causes of headaches are? Why do we get headaches? Stress.
Lack of circulation.
Okay. Blood flow. Misaligned spine. Bad what?
Bad diet.
Bad diet.
Yeah.
You guys are smart.
Allergies.
Allergies. Okay, you know what I didn't hear anybody say? A deficiency in aspirin. Okay, or a deficiency in Advil, or a deficiency in one of these prescription drugs that they give, you know what I'm saying? So we know that's not why we're having the headache, right? And we know that those drugs are prescribed just to dull the symptoms, but we still got the underlying problem. So let's get into that first. Before we talk about what we do and how we handle these things, let's just identify some of the different causes of the headache, okay? And migraines would fit into this, okay, so we'll kind of say migraines also, okay, but migraines are a little bit different, but they're certainly going to fall into this category of things we're going to talk about. And I'm going to give you just 10 things. I may give you more, I may think of some along the way that I want to add, but I could probably give you 20, okay, but we're going to talk about some of the causes, okay, and I'm going to start with a big one that's tied to what you said, Miss Belinda, about allergies, and I'm going to call this category autoimmunity. Okay, so how do allergies and autoimmunities tie together?
If you have an autoimmune disease, you have leaky gut, which
Yep.
causes allergies.
That's one tie. Okay, here's the other thing. You have an overactive immune system.
Oh yeah.
Okay, so yeah, you have an immune system that's overfiring. Now listen, when you have an autoimmune condition, the most common tissue that's attacked in autoimmune condition is what tissue? What do you think?
Gut.
Huh?
Your gut and your brain.
Nope, that's second and third.
Really?
What's the most common?
Autoimmune, the most common thing that's affected? Oh, the thyroid.
Yeah, thyroid.
Oh.
Thought you'd get that one. You weren't thinking.
Sorry. I should have gotten that one.
Uh-huh, right. So Shannon could tell you that, you know, that's a common problem, okay? But yeah, then right behind that is gut and brain, okay? So, you know, your brain can be under attack. That may be a reason why you're having a headache is because you got an autoimmune attack in your brain, especially the cerebellum and especially particular cells in the inner part of the brain around the basal ganglia, okay? Second thing is something called transneural degeneration. Okay, so here's how this works. This is very important to our topic tonight, and it's also very important to the solution of this. Transneural degeneration is, so you got all these brain cells, right? Okay, when do you have the most brain cells of your entire life?
When you're a baby.
When you're born. Yeah, when you're born. So, but how's your brain function at that time? I mean, what can your brain do? Not that much, right? Can't talk, can't walk, can't feed yourself, can't do a lot of stuff, but we got all these brain cells. So what's the, why? Why is that? Because they're not connected. They're not communicating with each other, see? And so what happens over time is the brain becomes connected, okay? The more connected your brain is, the better your brain works. The way the brain becomes connected is kind of like this, okay? So when a brain cell, a neuron, gets excited, then it begins to talk to all the other neurons around it. And then guess what? All the neurons that they're connected to, then they get excited. And so then you got all these neurons that are all excited and they're talking to each other, okay? It's kind of like a big, giant group hug. Everybody's happy, right? Transneural degeneration is this. This neuron dies. Now guess what happens? All those other ones that were getting stimulated by it, now they get weaker. You see? And then guess what? The other neurons begin to get weaker. And so eventually this one might get weak enough that it dies. And then guess what? Now all these other ones are even getting less stimulation. They're getting weaker, and then eventually, so transneural degeneration is ultimately where, because one cell, brain cells die, and then other brain cells die, and then other brain cells die, and you ultimately begin to lose brain cells. That's one cause of headaches, okay? The third one is a huge one, which is chronic inflammation. Okay, now chronic inflammation can come from a lot of different reasons. But I'm going to tell you another symptom that's closely associated with this, with headaches, is depression. If you have headaches and depression, you've got a brain that's inflamed. A brain that's inflamed slows down. Depression is nothing more than a slow working frontal lobe. It means your frequency of firing. You're going to hear me say this a lot. Frequency of firing. The brain cells, in other words, how fast do those brain cells fire is critically important. Okay, so when you have a decrease in when you have inflammation, you have a decrease of frequency of firing. Okay, so the next thing we're going to talk about has to do with this. It's called we can just call this leaky gut syndrome, but what I like to call it is gut on fire. If your gut's on fire, guess what? Your brain's on fire. There are chemical messengers that go from the gut to the brain. It's called the gut-brain axis. They're called cytokines. So there's a chemical messenger in your gut that gets turned on when there's inflammation. It talks to your brain and it turns on the glial cells in the brain, which also cause inflammation. So and it can go the other way, by the way, also. So the brain not only connects to the gut, but the gut's connected to the brain by way of cytokines, which are chemical messengers. So let's take it the other way and say you have a head trauma. You fall, you hit your head, your brain gets sloshed around, your brain gets inflamed. Guess what's going to happen? Your gut's going to get leaky as well. So you can get leaky gut from a brain injury, or you can get leaky gut from some other reason, Cheryl, and then you end up with a brain on fire. So inflammation, leaky gut, these two things go together a lot of times, okay? Let's look at the next one. Infections. Infections are a huge problem. Infections, gut infections, of course, are going to affect, they cause leaky gut, and that's going to cause inflammation, and that can affect it. But also, you can have infections that affect the blood-brain barrier. Okay? So the blood-brain barrier is what protects the brain from things getting into the brain that are not supposed to be in the brain. So you got other barriers. Barriers are like a wall. Think of barriers like a wall. Okay, this wall keeps me from going into that room. Okay, barriers keep things in and keep things out. Okay, if a barrier loses its integrity, then it lets things in that are not in there, and it lets things out that are not supposed to get out. So, for instance, like you've got a blood-brain barrier, you don't want certain things getting into your brain, like toxins, which we're about to talk about, like heavy metals, like mercury. Can you imagine? Have you ever seen a video of what nerve cells do when mercury is exposed to the neuron? It's terrible. The neuron begins to just like shrivel up and die. So guess what? Do you want mercury getting deposited into your brain? No. So you have a blood-brain barrier that only lets smaller things in. It doesn't let big things in. Okay? This is why a lot of times the supplements that you take are a waste, because you're trying to support your brain and you're taking something like GABA to try to calm down your brain because you're anxious, you got anxiety, and GABA's too big to cross the blood-brain barrier. So it's absolutely no effect unless you got a blood-brain barrier breach, and if so, you need to fix that. So, but infections are a common problem to cause a blood-brain barrier breach and then to allow things to get in, okay? And astrocytes and glial cells and things that are the immune cells of the brain get activated, and they cause a lot of damage. They're there to protect it, but if they're having to fire all the time, they're going to cause a lot of damage to brain cells. Okay, so now let's look at the next one. Since our class is ladies today, this is a big one. Hormones. If I have a migraine patient, a menstruating migraine patient, one of the first things I'll suggest is that we do a 28-day hormone panel. Because guess what? If you're having estrogen surges at times you're not supposed to throughout your cycle, then you're going to have headaches. Okay, and so this can be a common trigger for headaches, and especially the estrogen, progesterone. But there are other things involved in that too. I mean, you've got LH, you've got FSH. All these different spikes have to happen not only at the right amplitude, but also at the right time. So in other words, you know, a lady's menstrual cycle involves a lot of different hormones reacting at the right level and at the right time. And if that's not happening, you're going to end up with problems. And headaches are common. Next one. This one right here. I'm going to get into two of them now that we deal with on a daily basis. Okay, these are some of the most common reasons for headaches. Overfiring midbrain. Okay, also called a mesencephalon. I'm going to talk in more detail about this when we go through the slides. I'm going to explain this to you. But basically what happens is your body becomes sympathetic. Okay? You've heard of fight or flight, right? And Cheryl, I think you mentioned blood flow is a common cause of headaches, right? This is the trigger for the headache, is the blood flow change that comes from an overfiring mesencephalon. Because what happens when you're sympathetic is your body's sensing, Bev, that you're in an emergency situation. Okay, so guess what it's going to do? In an emergency fight or flight situation, your body's created intelligently. It's going to want a lot of blood to go to big muscles so that you can fight or flight. Well, it's not going to be a lot going to your brain because you don't need to learn math equations or remember what you're supposed to do when you go to the grocery store or whatever else at that time. You're just trying to survive. Well, if you're in that mode all the time, you're going to have headaches, short-term memory problems, sleep problems, fatigue, insomnia, all kinds of different things. Overfiring mesencephalon, midbrain. We'll talk about that. Second one, closely related to this, is cerebellum problems. Okay? Cerebellum problems, okay, are some of the most common reasons that drive the overfiring mesencephalon. But cerebellum problems might manifest themselves in starting to have less coordination, more balance issues. You might have some vertigo things, dizziness, lightheadedness. Those things are all controlled by that. But then the other big thing is posture. People don't realize that what controls your posture is part of the brain called the cerebellum. It's amazing once you start to understand what the brain does and you start to understand a little bit about how it works, what you see going on with people. And other people don't see it. And what you see, a lot of times, unfortunately, is you see a train wreck coming and nobody else sees it. And I'm like, I had this situation this week where Dr. K and I, when we left the room, we were like, none of the other doctors have seen this? Nobody else has seen that this patient's like a couple months away from getting diagnosed with Parkinson's? And nobody else has seen this, you know? But unfortunately, they're not looking in the right places. You know, when you just write in a prescription, you're not really doing a service to the patient a lot of times. So, cerebellum problems. And now the last couple, let's talk about this one right here, which is a genetic issue, MTHFR. How many people have heard of this genetic issue? Okay, right. Common problem. Why? What do you have trouble with, ladies, with this MTHFR gene problem? What do you have trouble with?
It spreads to all everything.
Yeah, but what's the problem with the gene? What's the gene not allowing you to do? Yeah, vitamin B, right? Okay. And vitamin B is not only critical for your nerve and brain function and health, okay, but it's also critical in the methylation pathway, okay? So what that means is your ability to take, Randy, we were talking about homocysteine to glutathione. B vitamins have to be involved in that conversion. So what happens is, to kind of simplify this a little bit, but let's say you have a free radical that comes into the body from a pollutant that's in the air or a food that you eat or from just oxidative stress inside the body. So a free radical is a cell that's dangerous, that it's unstable, and it can attach to damaged areas of your arteries and cause what we call atherosclerosis, right? It can attack cells and cause cells to die. And so you want to neutralize these free radicals. Well, your body has an amazing way to do this. It's called methyl donors. So you have these antioxidants like glutathione that have an extra methyl group on them, and when it sees the free radical going crazy because it's unstable, it puts the methyl group on there and it stabilizes the cell. But now, because I've given up part of me, I can be a little bit unstable. So now the body says, hey, we don't want to just waste this guy. Let's recycle him and use him again. So that's where the B vitamins come in, along with some other nutrients, to put that methyl group back on. And then it goes from homocysteine back around to glutathione, and it's ready to take on another free radical. Your body's amazing, isn't it? It's amazing. Complicated. It's complicated, but amazing. I mean, we don't even understand all of how it happens or what it's doing. God created it amazing, but it has the ability to protect itself. You see, and that's a wonderful thing about it. But if you have this genetic mutation, you can't get those B vitamins converted to the methylated form so that you can absorb it, and so then you can't convert homocysteine to glutathione. So you're susceptible to a lot of problems, okay? And that's why, guess what? You got to run the proper test. And guess what? Most doctors are not looking at homocysteine levels, not looking at folate levels. Now, let's go to the last two. Food sensitivities. Whoa, what's a common one? Yeah. Absolutely. Because it's going to, especially if you got this right here, Bev, if you got this overfiring mesencephalon going on and you take some caffeine, it makes you more sympathetic, major problem. Okay? It changes blood flow. All right? Kicks in your sympathetic, decreased blood flow. Guess what else? Gluten. Gluten is a huge trigger for headaches. I wish I had the time to show you some of the testimonies I've gotten over the years from headaches. I'm talking about people that have had headaches for, the longest one I've had that had headaches every day was like 14 years. Can you imagine living 14 years of your life with a headache every day? I had a lady, and this lady, that's terrible. This lady had a, she was seeing a chiropractor. And she was getting adjusted, but it wasn't phasing the headache. She was still having them every day. It would help with some things, and it might relieve the edge sometimes, and it might help some of the symptoms, but she's still having them every single day. And she came in to see me, and we did a very specific type of adjustment in the upper cervical area between the top bone and the skull, actually, that relieved over 50% of her headaches within just a short period of time. But she still was having them. So guess what? I said, you got something else going on. Get off gluten. She said, no, too hard, can't do it. I said, get off gluten, you get rid of your headaches. Okay, well, she did. And she did get rid of her headaches. But 2 weeks later, she fell off the wagon, and she had a hamburger, okay, because she was about to lose it, and because she was having a withdrawal, really is what was happening. She didn't realize that. And she laid out headache. Okay, then she got off. She's really clean. She's doing great for several months, and then all of a sudden she starts having headaches again. And I'm like, okay, what's going on? And come to find out, it was in her supplement. She bought from a health food store, not from us, okay, but she went on her own and bought some supplements, started taking some, had gluten in it. She didn't know it, and it started causing her to have headaches again. So food sensitivities. And then the last one we kind of touched on, toxins. Things like heavy metals, other stuff, plastics, things that get past the blood-brain barrier and cause problems. So, man, I mean, do you see why just prescribing an aspirin, a Tylenol, an Excedrin PM, or whatever else, you go on up, with the drugs, and they can get major, that's not going to fix the problem. Because, I mean, I could probably name another half a dozen at least if we just sat here and think about it for a little bit. These are common things that happen, okay? And so what's the key to this? Basically, the key is to run the proper test and do the proper exam, okay? And whatever else is necessary. So let's take a look and go through our slides, and let's talk about how we fix some of these things. And the first thing we're going to talk about is the neurologic side, okay? So neurologically, we've got to balance the brain. So you have to find out, do we have an overfiring mesencephalon? Do we have cerebellum problems? Has some of the inflammation now caused transneural degeneration, or has it caused decreased frontal lobe firing, or what's going on? Okay, so we're going to talk about that first. We'll talk about the brain-based therapy approach to dealing with these headaches, okay? And again, what's the difference? People ask me, what's the difference between a functional neurologist, like what Dr. K and I do, and a medical neurologist? Do you agree that there's a difference? Okay. Well, here's the way I explain it, the easiest way I know how. Medical neurologists focus on STDs, strokes, tumors, diseases. Okay? If you go in to see them, they're going to run a scan on you, an MRI probably of the brain, maybe with contrast, and they're going to make sure you don't have you got a headache, maybe you're having a tumor, maybe you're having a stroke. Maybe you are, okay? So let's rule that out first, okay? But then after that, guess what they're going to do? Well, good news, you don't have cancer, you don't have a tumor, and you're not having a stroke, so here's the prescription. Take this, have a great day. That's as far as they go. You understand? And I thank God they do what they do if you got one of those other three things. We need them for that, right? But it's not going to take care of the functional problems. Not any of the things that we talked about on that board right there. And then you got to evaluate the brain based on the different lobes to find out now, remember, frequency of firing. Where's the brain under firing at? Where is it not working and functioning normally at? And so you've got this cerebellum sitting here in the back. You got your frontal lobes, your parietal lobes, temporal lobes, occipital lobes, okay? These are the different lobes of the brain that we're going to be looking at. And there's even some different parts of each of those lobes that we look at. Now, this is where we're really going to come into where the cerebellum plays such a big role in everything else. Because normal brain function is all the signals come into the brain through the cerebellum. Okay? So, right now, your foot's touching the carpet. Okay, you got your shoe off. That's good stimulation. See, now you're getting more right now to your left brain than you are your right because you got the right shoe off. Okay, but if you walked around like that all day, that would create an imbalance. Okay, but for a few minutes, it's no big deal. But, and actually, that's a therapy that we do sometimes with patients with parietal lobe issues. But for her to sense that her toe is on the ground right now and to feel that carpet, the nerve receptor has to fire in the skin down there and fire the nerve going up into the spinal cord, up to your medulla, cross over, and fire into the opposite parietal lobe. And then, from there, okay, it still goes up into the frontal lobe, which we're about to see. So then signals go through the cerebellum, cross over at the medulla, go up into the opposite cortex, particularly parietal lobe, then into the, what is that, one area is 1, 3, and 1, 3, and 3, 2, and 1, right? Or 3, 1, and 2. Because they're 1, 2, and 3, but 3 is the first one to get hit normally. So then it's going to fire into the opposite cortex, okay? Frontal, parietal lobe, depending on what kind of signal it is, then into the frontal lobe. Then it's going to fire back down into the brainstem, okay? The brainstem is located below the cerebellum, okay? So that's normal brain function. Well, guess what happens if you don't get the signal into the cerebellum? You don't get the signal up to the frontal lobe, and you don't get the signal down into the lower brainstem. Now, here's why this is important. Your brainstem has 3 areas, okay? 3 parts. You've got the medulla, which is the lowest, the pons, and then you got the mesencephalon, which is your midbrain. This is where your sympathetic system is, okay? So guess what? These are mostly parasympathetic. So what happens is this frontal lobe fires into this area to inhibit, to turn off your sympathetic system. This is your brake on your sympathetic system, Shannon, okay? So what it does is stop you from being in an emergency situation. Keeps you from being in a sympathetic state. But here's the good thing about it. All we got to do to immediately ramp up our sympathetic emergency system is take the brake off. So it's on go. It's already ready. So in other words, like if somebody busts into this building right now and we needed to get out of here, our blood pressure would instantly go up, our heart rate would instantly go up, blood flow would start shunting to our big muscles, and we would run. Okay? You get it? Okay, but if this is not doing, if that normal brain function is not happening, if the cerebellum is under firing, you're going to have that overfiring sympathetic system. You're going to end up with not only headaches, but a lot of other problems. So why would something like this happen? Well, some type of trauma, some type of stress. And traumas are not all physical. You can have chemical traumas, physical traumas, and emotional traumas. So that's where somebody said stress, right? Can stress cause it? Yeah. Can an inactive lifestyle and lack of stimulation cause it? Yeah. Can blood sugar issues cause it, which would be chemical? Yeah, absolutely. Can inflammation? You betcha. Food sensitivities? Toxins? Oh, yeah. I always tell people, I went to a chiropractic college in Pasadena, and I said, you know, they don't even trust air over there. They can't see. You know, so I mean, there's a lot of toxins just in our air, right? So, some kind of trauma occurs, and then you begin to get a decreased frequency of firing, okay? And then when that happens, we get this cerebellum problem, which can cause all kinds of different things, okay? Blood pressure issues are very common. I had a lady here in my office. She's been a patient of mine for a long time. Her brother died. She had an emotional stress. Because of that, it had been going on, had been working on her, and she started to have tachycardia, high heart rate, okay? So I said, you know, this is not usual for you. I think this is neurologic. So what we did was we just did some parasympathetic stimulation. We put some sound in her ear. We had her do some deep breathing, had her do some humming, had her do a couple other exercises, and we put the pulse ox on her, and we watched her heart rate just boom, drop down from like 120 to 80. Just doing nothing but neurologic brain stimulation. You see, so that's just one of the things, again, that can be affected by this cerebellum imbalance. Here's the other thing. We didn't even touch on this as far as how all these things affect the brain. They all affect the brain a little bit differently, but one of the things that's important is the brain waves. So one of the things that we've now incorporated into our practice is neurofeedback. Neurofeedback is phenomenal for helping people with migraines and other types of headaches, along with insomnia and anxiety and depression and ADD and ADHD and all these other things, because it balances the brain waves. Well, really, the brain just begins to retrain itself to do right again. So if you get, not only can you have, remember, one lobe of the brain or one area of the brain that's out of balance, but you can also have the waves of the brain out of balance. And that can also cause headaches and other problems. So brain map, brain map is what's called a quantitative EEG. It's where you put basically an electrode cap on and you study the brain waves and all the different lobes of the brain to see if they're working normally, okay? And you compare it to a normal brain. So here we go. This is just showing us all the different things we talked about, all the different things that happen. Migraines because of blood flow, light sensitivity, because when you're sympathetic, you're dilated pupils. You're going to have insomnia, fatigue issues, all these different things, more pain, constipation, because you don't need to be digesting when you're trying to get away from a bear or something, right? Okay. Heart racing, of course. You want your heart rate to go up if you're in an emergency, because you want a lot of blood to pump, right? So this is an intelligent response, but you don't want it happening during a normal day. You see, you want it to happen only when you're in an emergency, okay? So this is what we just talked about. This is the blood flow. This is what causes the headache part of it, is that those blood vessels begin to dilate, and that changes it, and then there you end up with the headache. That's when the full-blown, boom, throbbing headache. So how's brain-based therapy different? You balance the brain back out. And here's the key, is the proper exam. So you do the neurologic exam, okay, the x-rays, the brain map, and then you go over all that and find out what the issue is. And now part of the physical exam here also involves the metabolic side, okay? These are some of the neurologic tests you do, some of the things you've already done, like finger to nose, Romberg's, which is where you put your feet together. You're looking at different things as far as coordination, heel to toe walk, perfusion. You're looking at oxygen levels. You're looking at circulation. So I put the sensor on your finger and it's low there. What does that tell me? It tells me you're in a sympathetic state, that the blood is shunning away to your big muscles and not going to the extremities and to your brain. That make sense? X-rays may be necessary because you know what? The one thing I didn't put on there, which is probably in most normal headaches, the biggest thing is your neck. Most people, the reason their head hurts is because they got a neck problem. Did you know the nerves from the neck, okay, kind of divide? The upper three nerves go up into the head. The lower four go down into the shoulders and arms and hands. So sometimes if you got a lower neck issue, you may end up with a lot of tension in the neck, numbness and tingling in the hands, a rotator cuff problem, or carpal tunnel. If it's upper part, headaches, migraine, vision problems, dizziness, lightheadedness, vertigo, stuff like that. X-rays are helpful. Sometimes MRI is needed. Cerebellum, that's the key thing. And really, that's the key to the whole thing because that's where all the signals start. And if it's not working right, nothing else works as well. So these are just some of the different things that we've treated with brain-based therapy and had great success with. So now, let's talk about one other thing here. Let's talk about what do we look at on the metabolic side. Remember how we said that you could be in an autoimmune attack? Sometimes when we also have headaches along with some dizziness, some vertigo, or some lightheadedness, or some coordination issues or posture issues, we want to look at GAD antibodies because that can be attack on the cerebellum. Or you're diabetic because GAD antibodies also cause diabetes. Okay? So there's different things that are tied in together. So we might be looking at autoimmunity. We might be looking at cortisol levels to see what your adrenal function's like. We might be looking at blood sugar levels. We didn't even talk on that. We could have put up a whole thing about blood sugar, too much or too little, how that affects the brain. Hormones we've already talked about. GI test. What we'll be looking at in a GI test?
You're not talking about that leaky gut. It's a permeability test.
Permeability test. That's a leaky gut test. Yeah. So what you do on that is you look and see if you have you have antibodies to the gut. There's 3 different types that you can have. You can have a dysbiosis where you have just bad bacteria and not enough good bacteria, and that's what's causing leaky gut. Or you can have a breakdown of the junction of the cells, or you can actually have a breakdown of the cells themselves, and you can tell from a test. The other thing is, guess what else we want to look for? Infections, right? And then immune panels to see again if there's an autoimmune issue. These are some of the metabolic tests that you may want to do. But it would start with a metabolic assessment form to see if which area it would point us to. So you kind of get an idea. So here's the thing. If you're suffering with headaches, what do you need to do? Well, you need to get the right test. You schedule the neurologic exam, which most of you have had. Hopefully you've had some metabolic testing. If you haven't done the metabolic testing, I recommend that you get my DVD on metabolic testing and find out what testing you need to be doing that you haven't done already and why you need to do it. The other thing is tonight when you leave, I'm going to give you a DVD that I did just about the neurologic side of this that you can keep for reviewing. It tells you more about what you need to be doing to keep your brain healthy and balanced, and also something you can share with someone else too. Okay? And then of course, the brain map. And a lot of people, they neglect the brain map, and sometimes they're still having some issues that they may not have even told me about. Like for instance, I had a patient, Linda was telling me about, I didn't even know this, how much better she's sleeping since she started doing neurofeedback. I didn't even know she was having a problem sleeping. You know, sometimes patients just don't tell you things because they don't think it's important, right? Well, they don't realize that it's all tied together. You know what I'm saying? So your adrenal function and your headaches, you come in and see me for headaches, but you got poor adrenal function, which is stopping you from sleeping, and then all of a sudden you start to get some things doing better, and you're like, hey, guess what? I'm sleeping better. Hey, I'm digesting better, whatever else it may be. A lot of times people notice they have more energy. They don't realize that that's tied to better brain function. I'm thinking better. I got more clarity. Okay, I'm remembering things better. I'm not forgetting why I went in the room as much. That's important. That means your brain's working better. Okay. So if you haven't had the proper testing, this is what I do. For the neurologic, the metabolic, and the brain map, I normally charge $485. I'm doing the special with anybody from the workshop or somebody you refer to me in the next 2 weeks from the workshop. It'll be $95. Okay. That'll include about an hour for the exam, including x-rays and the brain map. These are my conditions. You must have your spouse. If you're married, be present when I do the report. I like to have them in the examination because here's what happened the other day. This woman can't understand why she can't sleep. She's taken all the drugs. She's done, you know, everything, hypnosis, acupuncture, all this different stuff, okay? She can't sleep. Guess what? her brain doesn't work right, okay? So I said, okay, let's do a test, because she's kind of not getting what I'm telling her. You know, she doesn't see what's going on with her. So I said, okay, let's do Fukuda's test. It's a step test, okay? So all I had to do was just close her eyes and march in place. And I just stood there. Dr. K, you were in the room with me, I think, when this happened. And I said, just stop when I tell you. Some of you have done this test, you remember. Well, this lady did this. I stopped her right here. She opened her eyes. Do you think she'd finally realize that this is why you can't sleep? You know, that's a problem. She thought she was still facing the same way. That's the imbalance of the brain. You see? So this side's firing really good. This side's not. You see? So she turned all. If I let her go long enough, Cheryl, she would have come all the way around and thought everything was normal, because she never knew she moved. You know. So, and it's different depending on what part of the brain it is. Okay. So you can have other things where you'll go forward and sometimes you'll go backwards and whatever. But the point is that I like to have the spouse in the exam sometimes so they see what's really going on, and at least they need to be here at least for the report of finding, so they know what you're going through. You know, it's hard for somebody to really appreciate what's going on, especially you get frustrated when you've tried so many different things, you've been so many different places. People get jaded. I have to deal with this a lot, you know. They're like, okay, well, what, you know, I already went through that with somebody else. And no, Mary, what they really went through was a canned program that what they do for everybody, that's always the same, there's nothing special about it, and it helps some people, and some people it doesn't. You know what I'm saying? But it's not specialized, and so now they're not certain that they want to do the program with us because it didn't work before. Not the same thing. So these are some of the things to keep in mind. All right. So if you know somebody, or if you personally are still having some issues that you need me to address, make the appointment. Let's get the brain map done. Let's get the neurologic assessment forms done. Okay.